Dear all, Namaste. Today I shall be describing about otomycosis. Otomycosis is defined as fungal infection of external auditory canal. The different fungi leading to otomycosis are Aspergillus niger, which is a black fungus. So when the patient has black discharge from the external auditory canal, that is due to Aspergillus. Candida albicans, white fungus. In common terms, when the patient is having wet filter paper appearance, that is infection due to Candida albicans, and when the patient is having wet newspaper appearance, that is Aspergillus niger. Newspaper is blackish in color. Dermatophytes also may lead to fungal infection of the external auditory canal. This condition is common in extremely moist environment, sometimes hot environment due to sweats entering inside the external auditory canal, or chronic bacterial otitis externa, which is the predisposing factor for superinfection by the fungus that leads to fungal infection. The patient may present with itching of the ear, which is very common condition. There will be severe itching on the external auditory canal or in the ear. Patient may have oral fullness due to fungal debris inside the external auditory canal. Patient may have severe earache and discharge from the ear, and occasionally swelling of the pinna and the external auditory canal. There may be temporary canal stenosis, or patient may have impending pericontitis of the pinna also. On examination of the ear, there will be grayish-white debris resembling wet filter appearance, filling the meatus in Candida albicans, and black specks in the debris. Conidiophores of aspergillosis can be seen. The canal wall may be injected. After we remove the debris, there will be congested external auditory canal. You can see here, this is mixed Candida and Aspergillus infection. This is true Candida infection. This is also mixed infection, and you can see white debris here with few black debris also. This is Candida albicans. How to treat otomycosis? There is no need for investigation. It is a clinically diagnosed condition, but important is thorough cleaning of all accumulated debris. Although syringing is contraindicated, you can simply clean the external auditory canal. You can use suction or you can use warm water. Anti-allergen medicines to decrease the itching, analgesics for pain, and antifungals for fungal infections can be used. Both topical as well as systemic antifungals can be used. Topical antifungals like nystatin, clotrimazole can be used for 2 to 3 weeks because the fungal infection needs longer time for treatment. They are fungostatic medicines. They are not fungicidal, so they will stop growth of the fungus, not kill the fungus. Topical Jensen violet solution has antifungal property as well as antibiotic property, as well as it can help the epithelium to regenerate. So this is very good medicine to be used in fungal infection of the external auditory canal. Systemic antifungals can be used for short time when there is severe infection of the external auditory canal. We usually give fluconazole or ketoconazole. Systemic antifungals like fluconazole also can be used. Borate solution, which is 5% aluminum acetate solution, can be used to reduce the swelling and remove the fungal debris. As already told, the best treatment is thorough cleaning of the debris time by time. So patient has to come time by time for follow-up. When the patient has severe pain, we can use analgesics. Sometimes patient needs suction clearance with the help of microscope also. Otomicroscopy also can be used. As I have already told, the infection takes a long time for settlement. So the patient has to use medicines for at least 10 to 15 days. Please subscribe my channel, Dr. Krishna Koirala, for further videos like this, which are important for both your theory as well as practical final ENT examination. Thank you.